Today on the show, a program designed to scale oncology education and meet the evolving needs of cancer care nationwide. Welcome back to Cancer Buzz, where we cover the latest in cancer care. I'm your host, Summer Johnson. Our guest today is part of a comprehensive cancer-focused research training and education continuum designed to cultivate the next generation of oncology professionals. Tristan Blanco is a biology major and fellow in VCU Massey's cancer-focused undergraduate research experience, or the CURE program.
So I actually heard about this CURE program through my mom. She went to VCU and she always talked about how big and respected Massey was. So I already knew it was a huge cancer center, and that kind of made me curious. But I eventually looked into the program myself. I decided to apply because it felt like the best way to actually get involved in something meaningful. A big part of my motivation though, it came from my family. Uterine cancer, it kind of runs in all the women in my family. My grandma, she was able to beat stage 5 uterine cancer. And my mom later had to get screened because of that. And so my mom ended up having, that kind of led to a hysterectomy to help prevent it. So I'm grateful that we caught it early. I'm a huge advocate for early screening and prevention. And I actually have 2 sisters, a 10-year-old sister and a 21-year-old sister. So in the future, that means that they could possibly have it too.
The program aims to create effective cancer care long before providers are working with patients through education, mentorship, and access.
The most valuable thing I've learned so far is probably how to communicate complex science in a way anyone can understand it, no matter your audience. In the lab I'm working with, there's things like ferroptosis or SIRS1 knockdown. They're really technical topics, but CURE, it taught me how to take that complexity and explain it clearly to different audiences, high schoolers, scientists, or even my 10-year-old sister. So I think that's one of the most important skills I can have as a future doctor. No matter what specialty I go into, really, whether it's radiology or oncology, I feel like I'll need to be able to explain difficult things to patients in a way that makes them feel understood and not overwhelmed.
Here's Blanco on that mentorship aspect of the program.
Talking to Dr. Robert Wynn, he's the director of Massey, and he talked a lot about resilience. Their slogan is one team, one fight. And he was talking about pushing through these challenges and showing up when things get hard.
Blanco also talked about the hands-on experience that students get.
When Massey creates these programs, they're supporting and teaching the younger people, like myself. And Dr. Wynn also told me we're building the next generation of researchers, clinicians, and leaders. And now thinking about it, it's I think it's one of the smartest ways to address the workforce shortage. We're making sure more students get the chance to discover oncology and have that opportunity, more interests, more scientists, more everything.
Finally, here's Blanco again on what he learned about leadership.
I feel like Massey has allowed me to become a better mentor. And then on the flip side, I was able to ask higher ups, medical students or postdocs, what to do before or what to do after I graduate college. And yeah, it's kind of a full circle thing.
Thank you to our guests today. If you'd like to learn more about how VCU Massey built an equity-driven pipeline spanning high school classrooms to postdoctoral fellowships, you might want to check out Building a Scalable Model to Train the Next Generation of Oncology Leaders. That's in the Volume 40, Number 5 issue of Oncology Issues. You can find that in your email inbox from ACCC. Thank you for listening. Until next time, for the Cancer Buzz team, this is Summer Johnson.